Well, welcome back, everyone. Today we have Dr. Fadi Abbass. He's an ENT specialist at Lima Memorial, and he's here to talk about a new medical device that's available at Lima Memorial for those experiencing obstructive sleep apnea. So thanks so much for joining us, Doctor.
It's my pleasure. Thank you for having me.
Yeah, so can you give us some background on what sleep apnea is and how it's usually treated?
So sleep apnea is a very common condition where the upper airway collapses during sleep. This can cause significant issues in terms of ventilation, oxygenation, and sleep fragmentation, and it can have a profound impact on overall health. It is usually treated with CPAP. I think most people are familiar with the CPAP machine, which basically is a positive pressure applied to the airway through a mask in order to prevent collapse of the upper airway.
Yeah, so I've heard of this thing called Inspire therapy device. So how does the Inspire therapy device work compared to using this, let's say, the CPAP machine?
So just like I just mentioned, the CPAP machine basically involves wearing a mask and a positive pressure applied to the upper airway. It is effective and it works when you are able to tolerate it. The problem with CPAP is that many people are unable to tolerate it simply because they can't sleep with a mask strapped on their face. So the Inspire is a relatively new technology where basically what we are doing is we are selecting certain muscles in the upper airway and we are stimulating those muscles and timing it in a way so that when you are taking a breath in during your sleep, these muscles are getting stimulated and are opening up the upper airway.
Very interesting. So what kind of improvements can maybe patients expect to feel when using the Inspire device?
Actually, the improvement can be quite dramatic. In fact, what we're seeing is that over 90% of people are having numbers on their sleep studies that are either normal or near normal in terms of the sleep parameters.
Wow. So what kind of procedure is needed to start utilizing this device? And also what requirements does the patient need to schedule for this kind of procedure?
The procedure itself, it's an outpatient procedure. It takes between 1 to 2 hours. It involves 2 incisions, one in the upper neck, one in the upper chest. You're in recovery for a couple hours, you go home, and the device is activated usually 30 days after the surgery. Now, there are some criteria that need to be met prior to the procedure. Obviously, one of them is not being able to tolerate the CPAP machine, which is still the standard therapy. There's other criteria involving BMI, body mass index, the severity of the sleep apnea, and certain anatomical factors.
Okay, so if patients are interested in scheduling this procedure, they can get in contact with the Lima Memorial Ear, Nose, and Throat office, right?
Yes, absolutely, and our professional staff are trained to help them go through the process of getting approved for the procedure.
All right, fantastic. And you can actually visit online at limamemorial.org/schedule, or you can just call by calling 419-998-8244. Well, Doctor, thanks so much for joining us today. I really appreciate it.
Thank you. My pleasure.
All right, well, don't go away because we have more when we return.